to thank everybody that came for taking an hour out of their lives to learn a little bit about health. And tonight, we're going to do a talk on endometriosis, which is a real issue with a lot of women. And the reason I'm doing this talk is because I think that women who have this issue need some alternatives, and they need to understand and get information that can help them make better choices about their health. And that's why I do all these talks, because I want my patients to make wiser choices about health. And if you have, the more information you have, the better choices you can make. So down the road, I don't know how far down the road, we're probably going to do one on PCOS and uterine fibroids, but two that are going to come up later this year, or one is going to be, why can't I sleep? The other one is going to be, why am I so tired? Okay, we're going to do two. Those are going to be two brand new talks. So without any more delay, let's talk about endometriosis. It comes from the word endometrium, which lines the uterus, the tissue that lines the uterus. And endometriosis is basically when uterine tissue gets in the wrong location in the female body. And the thing is the endometrial tissue responds to hormones like estrogen, progesterone, testosterone. And so when a woman has her cycle, if there's endometrial tissue that's outside of the uterus, this can cause problems, okay? And so the clinical consequences can be pain, scarring, and fibrosis, which is not what you want. You don't want scar tissue all over your abdomen. Now, this is what we see. This is extra abdominal endometrial tissue, which is outside the reproductive area of the female. So it's estimated to affect about 7 to 10% of all U.S. women, and a lot of these women, there's 20 to 50% of the women that undergo laparoscopy, they find that they have endometriosis. They didn't even know they had it. Okay. Lesions may include ovaries, ligaments, uterus, colon, and the size usually 2 to 5 centimeters, but maybe up to 20 centimeters. You know, it's about 2.5 centimeters per inch. So we're looking at probably about, 6 inches, which is pretty big lesion, okay? Most commonly, women that have endometriosis, they have pelvic pain and they're not fertile, okay? And pain can be very debilitating. Infertility can affect 1/3 to 1/2 of all women with endometriosis, regardless of the number of prior pregnancies. The symptoms of endometriosis don't always correlate with the amount of lesions that they have. And it can be mistaken for pelvic inflammatory disease, polycystic ovary syndrome, and irritable bowel syndrome, because the symptoms are a lot alike, or they can be. So let me just tell you, pelvic inflammatory disease is an infection. It's like chlamydia. Endometriosis is not an infection. So this would be pelvic inflammatory disease right here, but that comes from a full-blown infection. So endometriosis, the visible lesions don't necessarily correlate with the pain. What's more important with endometriosis is how deep the lesions have dug in to the tissue. That is much more correlative with pain than the amount of lesions. So here's some symptoms, and we won't spend a lot of time on these. Low back pain, abdominal pain, pain during, going to the bathroom, pain during sex, irregular heavy bleeding, diarrhea, constipation, bloating, vomiting, or nausea. I mean, that could be a whole lot of different things in the body, and so that's why differential diagnosis and really getting a good case history is really important. Fatigue, malaise, I mean, I see that all the time in patients. Pain during exercise, okay? Risk factors. family history, fallopian tube, or uterine defect. So let's say you have like a pregnancy that, or the ovary or the fertilized egg gets stuck in the fallopian tube and you need surgery, you know, that defect could lead eventually to endometriosis. Early cycles, starting your cycle real early, which by the way is happening more and more women in our country because we're exposed to so many estrogen type chemicals like plastics, for example. Delaying in childbearing, heavy bleeding during cycles, and a history of pelvic infections. These, because the pelvic infections will scar this area here, which can contribute to endometriosis.
I got a question. A uterine defect, would that be like a tipped uterus?
Yeah, could be.
Okay.
Yeah, retrograde uterus, sure.
Okay.
Yeah, absolutely, could. In reproductive age, endometriosis is driven by estrogen. Really important concept later on. Common in reproductive age women. Hi, Terry, come on in.
Hey, Paul.
Women that have never had kids or menstrual cycles that last a long time is an underlying feature, and it can occur in 25 to 50% of women with fertility issues. So endometriosis is common, you know, in infertile women. So let's look at the causes. There's 4 different theories of why endometriosis happens. One is retrograde menstruation, where menstrual blood does not go where it's supposed to. It goes out the fallopian tubes into the pelvic cavity and over the ovaries. Okay, so and then it takes root in there and it grows. So that's one theory, you know, and this would be again tipped uterus, uterine abnormalities, things that would make the blood flow in different directions. And you can see here on the ovaries that this endometrial tissue can actually start growing on an ovary and cause problems. The lymph system is another theory. This theory is that endometrial tissue is spread throughout the body via lymph fluid, okay? And it may be caused by surgery into the abdomen. That could spread endometrial tissue. The reason that people think this or believe in this theory is because endometrial tissue has been found on lungs, gallbladder, kidney, spleen, in the nasal mucosa, stomach, breast, and central nervous system. It's got to get there somehow, okay? And I don't see how it can get from the pelvic cavity to a breast or the lung, you know, get through the diaphragm. So it's got to get there somehow. Tissue metaplasia. Now this is another very interesting theory. Now the lining of the abdominal cavity is derived from the same cells as the lining of the uterus. And so this theory is that you have normal cells, and then you have irritation from retrograde menstruation fluid or high doses of estrogen therapy turns normal cells to uterine cells. And so this is another theory that has been proposed. The 4th one is toxicity. Now this is a real interesting one. It has been hypothesized that cells in the pelvic cavity may transform into endometrial tissue when exposed to toxic chemicals. Well, we're exposed to toxic chemicals all the time, like hormones or chemicals which act like hormones, like bisphenol A, plasticizers, and phthalates, which, you know, if you get one of those really soft plastic drinking bottles, it's full of that, okay? Dioxins, pesticides, and formaldehyde. I mean, we're exposed to that a lot, okay? So patients with endometriosis tend to have higher levels of toxins in their blood. Okay, well that makes sense too. You know, so here's another one. consumption of trans fats has also been correlated with increased risk of endometriosis. So where do we get trans fats? What? Yeah, junk food.
Yeah.
McDonald's.
Yeah.
Someone I always think of as potato chips because I see it on the bag.
French fries.
Yeah.
Okay, fast food. I mean, I know nobody in this country eats fast food, but there are some countries where they do eat it. Okay, so trans fats. So we're in our household, we're pretty careful about that for the most part. I'm not saying that we never eat any, but we try and consume a lot of healthy fat, and so that's another interesting issue. So, how is endometriosis evaluated? Well, ultrasound is a pretty good screening tool, but it doesn't catch everything. MRI is really good. It shows a lot of detail. But why would MRI be like maybe somebody's second choice?
Radiation?
No, there's no radiation with MRI.
Oh, there isn't.
No. Say, why would somebody choose ultrasound over MRI? Let me put it that way. That's a better way to phrase this question. Why do you think that is? Okay. Well, first of all, ultrasound's a lot cheaper than MRI. MRI is expensive.
Yeah.
It's expensive to get an MRI. A lot of insurance companies won't pay for it.
Mm-hmm.
So, and the last thing is laparoscopy, which is the standard for evaluation. Laparoscopy can be limited by large adhesions. Okay, so the advantage of laparoscopy is that they can take some of the lesions out while they're actually doing the test. Okay. So they can be excised with the diagnostic procedure. I can see why they'd want to do it, but it just doesn't sound I just wouldn't want to have it done to me, to be honest with you. So what are the treatment options for endometriosis? Pharmaceuticals. So non-steroidal anti-inflammatories, which basically kill the pain. They also destroy your intestinal tract bacteria and affect you hormonally, which isn't good. Birth control pills, progesterone, gonadotrophin releasing drugs, which are hormone type drugs. Those are all things that are used. The problem is, what's a problem with all of these? What's the issue with using those?
Not natural.
Yeah, they all have side effects.
Side effects.
Yeah, they have side effects. And, I'm not saying that all drugs are bad all the time, but all drugs have side effects, okay? So surgery, there's all kinds of surgical procedures, laparoscopy, ablation, presacral neurectomy, hysterectomy, which this is not an option for somebody who wants to have a baby.
No.
Okay.
Yeah.
No.
So, it's the other ones, and so there's got to be other ways that we can deal with this issue, other than medical, some of the medical type procedures. So, if you look at the prognosis, spontaneous remission occurs in 1/3 of all untreated endometriosis cases. That's pretty good. Estrogen, progesterone combination drugs tend to relieve the symptoms of pelvic pain in 85% of all cases. The problem is when you give women those drugs, it screws up the rest of their hormones. Your body, our bodies use hormones one molecule at a time. Okay, that's as they need it. Okay, it's this just-in-time system that our body has. So our body uses hormones as they need them. So when you flood the body with all kinds of estrogen and progesterone, what happens is you downregulate the receptors, and it's like putting that part of your body on welfare, and it just doesn't work right anymore. Okay, drugs which suppress ovulation have been reported to be effective for managing pain. in 95% of all cases. But drugs that suppress ovulation,
No baby.
I mean, no baby, and you're dealing again with a powerful drug that has side effects. So yeah, and the above pharmaceutical treatments can interfere with fertility goals. You bet they can. Okay. So we want to support normal physiology with an endometriosis patient. So if you have a woman that has normal cycles, that's an indicator of reproductive health. Okay. So if you take a woman, and I've read stories about this, if you take a young girl and you raise them up like a whole food diet, no sugar, real food, the chances of them having a normal cycle are going to be pretty high. But you take a kid, a young girl, a little girl, and you give them lots of like things like macaroni and cheese and, you know, McDonald's Happy Meals and things like that, they're going to have problems. Okay. Women like that grow up on that kind of diet have severe cycle issues. Okay. Now, let me ask you a quick question. I should give you a prize if you can answer this one. This is a hard question. It's a good one though.
Okay.
Okay. So why would a girl specifically that's raised on junk food, fast food, why would they have issues with their cycle? Why would that happen? What would cause that? What's the mechanism that's going on there? Anybody? It's a hard question. I know. It's a tough question. Okay, so what are hormones? What are your hormones made out of?
Fat.
Cholesterol.
Cholesterol. Yeah, fat, cholesterol, fat. Okay? So a little girl that's raised on all kinds of bad fats, that's going to completely upset her fatty acid balance, cause inflammation. She won't have the right kind of fats to even manufacture hormones. So your hormones are really, your sex hormones are all made out of cholesterol. It's like the tree in the forest is the first thing that you use to build a house. You cut that tree down, you get wood out of that, and you frame the house. Cholesterol is the initial primary building block of all your sex hormones. So if you screw that up, and these bad fats cause liver toxicity, your liver is a primary generator of cholesterol in the body. So that's why this can happen. So let's look at holistic consideration to this. So there's things that contribute to the severity of the symptoms. Okay, so we discussed this. Poor diet. Okay. Sugars, processed food, you got to decrease all this, and you need to eat more nutrient-dense foods. Digestion doesn't work well in probably 70% of the patients I see. I can tell it on blood work. I don't even care how they feel. They feel their digestion is okay. If I see low protein on blood work, it's not working well. And toxicity, so eliminating toxic exposure. So one of the obvious ways you can do this, eliminate this, is you don't microwave in plastic. Okay, you just don't do that. Okay, and you can get rid of as much plastic as you can. So let's look at liver, because the liver detoxification is really important for maintaining healthy hormone levels. Because once your body cycles through these hormones, they get detoxified in the liver. So if your liver is toxic, okay, those hormones just build up. And pretty soon you got more estrogen than you need, and that causes problems. So a toxic liver really is an area that you have to start. So herbs like milk thistle, schizandra, really good for clarifying or helping the liver. There's some other things too, but Those are good. NAC is another one. I could have put that one up there. You need adequate gallbladder and bile function. And why is it? Why is the gallbladder important in all of this?
It helps digest the fats that are at the lower end of your intestinal tract.
Yeah, great answer. It helps you digest fats, process fat.
Yep.
You don't have a gallbladder, it's a lot harder to process
You're not
fats.
gonna do
Yeah.
too well. Yeah.
That's why you take supplements.
Yeah, that's why I have Colacol. It's gallbladder in a bottle. You know, it's the only product I have that's like that. Cruciferous vegetables are really helpful. Very powerful in detoxifying. So like Brussels sprouts. There's a lot of
Broccoli.
creative ways to make Brussels
Cauliflower,
sprouts now.
cabbage.
Broccoli, cabbage, right? Kale, cauliflower. Those are all the cruciferous vegetables. Okay, so look at herbal therapies. So there's very specific herbs which are really, really good for managing endometriosis. Some of them are anti-proliferative. They stop the growth of tissue, anti-inflammatory, anti-angiogenic, which means they stop the growth of new blood vessels. Because if you can stop this, you know, you can stop the growth of cancer, you can stop the growth of anything that shouldn't be growing in your body. Antioxidant, and you want to decrease estrogen receptors. So there's certain plant-derived compounds or herbs that have really solid evidence for helping with endometriosis. And by the way, there's a lot of good research on herbs, really high-quality research. So this is not soft science. Just because you don't see it on the pharmaceutical commercials on TV doesn't mean there's not research on it. So let's look at key herbal support. Chaste tree. This is almost specific for endometriosis. So when you give 3 grams a day, it suppresses estrogen production in the body. And there's no side effects from it, okay? This is not a hormone. So it's an herb that will help dial down the estrogen issues in the body so the body can heal. So it provides support for the anterior pituitary gland and support for conditions involving progesterone deficiency. So chaste tree is really good for a lot of things, okay? So you would give it to young females having problems with their cycle, but in smaller doses, because you don't want to shut down their estrogen production. So you want to support it, so you give it in smaller doses. Evening primrose oil is another one. Really helps reduce prostaglandin production. Now, prostaglandins are the chemicals in the body that your body makes from fat, the wrong kind of fat, which produces inflammation. So eating primrose oil really dials down the inflammatory mechanisms in the body. Really, really good for female productive disorders, good for reproductive and related inflammation. Borage oil, flaxseed, and hemp seed oils also contain gamma-linolenic acid, but evening primrose oil is like the queen of those oils, okay? Another one is Echinacea, which we use a lot in our office. Echinacea, one of the things with Echinacea is it decreases cyst formation. So we use it for immune health. I use it all the time for immune health, but this is another characteristic. It decreases the body's ability to make cysts. It reduces inflammation and has very broad systemic effects to increase overall health. One of the top herbal experts in the world, he's written several books on it, award-winning books, is a guy by the name of Kerry Bone. You probably never heard of him, but he calls Echinacea the duct tape of the body, okay? That's one way of saying it, but this is his favorite herb. It's like the duct tape of the body. So Gotu Kola complex. Now Gotu Kola is really good because it reduces scarring and adhesions. The Gotu Kola complex, it really helps support connective tissue. and microcirculation. So any autoimmune condition where fibrosis occurs, gotu kola is really, really good for that. Dong Quai, so another one, anti-inflammatory, a great female tonic, excellent for dysmenorrhea, especially when combined with white peony. White peony is another herb. So these are some. Now, for me, if a woman came into me as endometriosis, I would use chaste tree, evening primrose oil, and echinacea. I'd probably use that combination right off. Okay. Plus, I'd want to look at their liver, see if that's working properly. We want to do a very thorough diet history, and when I look at my functional medicine patients, some of the diets they give me, I just can't believe that this is what they're eating, but they do. All right. So final consideration: endometriosis cases can take time to resolve. Okay, so this isn't something that gets better in a month. Okay. Severe cases can take 9 to 12 months or longer, so it takes time to fix these things. Really important that the person that you're working with is eating a good diet. Okay, they're taking the supplements like they should. Okay, and a holistic approach is really important. And then when you get the endometrial lesions resolved, or they're under control, so they're not causing all these problems, that's when you work on restoring a normal menstrual cycle. So that whole process can take some time. I mean, think of it this way, because most people, a lot of people in our culture, they can't understand why does it take, so much time to get somebody well? Well, how long does it take to educate somebody in a college course? 4 or 5 years. 4 months. You have one course, one course. 4 months, 3 times a week. Okay, that's the typical time you go to college and you take a class. 4 months, 3 times a week. So if somebody's abused their body for 10 years or 20 years, should it take any less time in trying to educate somebody in a college class? No. Sometimes it takes a long time to get these people well. Okay, because their whole body's full of sick cells, and you got to get those cells healthy. Good. So that's all I have. Do you have any questions about what I've gone over? I could have made this a lot longer. There's a lot more information that I could have put in here. I just wanted to give you the basics, so you have just a basic understanding of how this works. Terry.
A woman comes into you, she wants help. She's got endometriosis, but she also has dysmenorrhea. Which one do you go after first?
Endometriosis.
Okay.
That's what I would do first.
Because the endometriosis could be causing the dysmenorrhea.
It's very possible.
I would think, yeah.
And so the two tend to go hand in hand. Okay. But I'd fix the endometriosis first. Then we'll worry about the other one.
Yeah.
For sure. Yeah. Yep. That's what I would do.
Yeah, I had endometriosis so bad that they ended up having to do a hysterectomy. And I'll never forget, they told me, it was like a 5-month pregnancy size, the cyst was. And they said that, I had no symptoms that I knew of, because back then they didn't know about endometriosis as much. So, now of course there's other options, but.
Yeah, we've learned a lot.
Yeah.
Mm-hmm.
In the last 15 years, to me, it's absolutely astounding how much we've learned about nutrition and how the body works.
Exactly.
It's just unbelievable.
Thankfully.
Yeah, thankfully, right, thankfully. I mean, when I was in chiropractic college back in the late 70s, I mean, we had nutrition classes, but to be honest with you, we didn't know jack back then. We didn't. We didn't know anything back then. I mean, nobody knew anything back then. The only thing we knew back in the 70s is you needed fiber in your diet. We knew that, you know. We didn't know that, you know. So anyway, we've learned a lot of things since then. That's yeah, so good. So that's all I have for you. It's 7 o'clock. Thank you so much for coming to my class, and I hope that you've learned something. If you want notes for this, I'm going to get you some. I wanted to get some today, but I ran out of time to put them together. But I'll get you some notes, and we'll put the information on the slides and the notes, and you can have that.
Did you say 5 to 10% was all though originally in the very first slide? I think it was. Didn't you say something about 5 to 10% was?
Let's see.
Go back to the beginning.
Let's see. We go.
It was like the first or second slide, I think, because I was in shock. There you go. No, it's after that then. Yeah, 7 to 10.
7 to 10% of all U.S. women are affected.
See, I would think it'd be a whole lot higher than that.
Well, it may be now, you know, but we know at least that many.
When was this put together?
Well, I put this together, you know, just recently,
so 7 to
and
10%
the information is fairly current.
Interesting,
but now way more women than this are affected by dysmenorrhea. So you know, way more. But you know, this is what we know for sure is 7 to 10%.
Huh.
Okay, good. Thank you very much.
Thank you.
And here's a schedule of our upcoming talks. Our next one is on lifetime care. How do you care for your body for your whole life?
Your whole life.
And then after that, what is the science supporting chiropractic? And then May 10th, how not to shrink your brain. Okay, in other words, yeah, how do you keep your brain healthy? What are the things people are doing that shrink their brains? Okay, lots of things. So you want to find that out. Okay, thank you very much. God bless you guys, and